Article 517.20 requires ground fault circuit interrupter or GFCI protection for receptacles within 6 feet of basins in patient care rooms unless interruption of power can be tolerated without adverse impact on patient safety. Article 517.21 provides an exception to the requirement of 517.20. Specifically, if a patient care room has both a basin and a toilet, then ground fault circuit interrupter or GFCI protection is not required for the receptacle near the basin. The term critical care area is not mentioned in the exception of Article 517.21. Therefore, this exception applies to all patient care rooms, regardless of whether they are designated critical care areas. The rationale behind this exception is that the presence of a toilet in the patient care room indicates that the room is a bathroom. Bathrooms typically have a wet environment due to the toilet or shower. As such, it is assumed that all receptacles in a bathroom are already protected with ground fault circuit interrupter or GFCI protection. Therefore, if a patient care room has both a basin and a toilet, it is assumed that the receptacle near the basin is also protected by the ground fault circuit interrupter or GFCI protecting the receptacle near the toilet. This exception does not apply to receptacles in showers or adjacent to bathtubs, which require ground fault circuit interrupter or GFCI protection regardless of the presence of a toilet. To elaborate on the specific requirements of Article 517 and ground fault circuit interrupter or GFCI protection, especially in patient care areas, several aspects need to be understood. Firstly, the purpose of ground fault circuit interrupter or GFCI protection. Secondly, the scope of Article 517. Thirdly, the specific requirements within 517.20 and 517.21, and fourthly, a practical application of these rules. Ground fault circuit interrupters, or GFCIs, are designed to protect individuals from electrical shock. They work by monitoring the current flowing in a circuit. If there is an imbalance between the outgoing and returning current, even a very small one, it indicates that current is leaking, potentially through a person. The ground fault circuit interrupter, or GFCI, then quickly cuts off the power to prevent injury. The threshold for tripping a ground fault circuit interrupter, or GFCI, is typically around 5 mA. Article 517 of the National Electrical Code, or NEC, covers healthcare facilities. This article addresses the unique electrical requirements of hospitals, nursing homes, clinics, and other locations where patients receive medical care. These facilities require special electrical safeguards to ensure the safety of patients, staff, and visitors, given the increased risk of electrical shock due to medical equipment and patient conditions. Article 517 acknowledges that healthcare environments have unique risks. Patients may be more vulnerable due to medical conditions or procedures, and the presence of sensitive electronic equipment requires a higher degree of electrical safety. The requirements in Article 517 are designed to minimize these risks. Now let's delve into the specific requirements of 517.20. This section mandates ground fault circuit interrupter, or GFCI, protection for receptacles within 6 feet of basins in patient care rooms. A basin is a sink used for washing. The proximity to water increases the risk of electrical shock. The requirement is intended to protect individuals from electrical hazards when using electrical equipment near the sink. The exception to this rule, as outlined in 517.21, provides a conditional exemption. If a patient care room includes both a basin and a toilet, the ground fault circuit interrupter, or GFCI, protection is not required for the receptacles near the basin. The rationale behind this exception is rooted in the assumption that a room with a toilet is considered a bathroom, implying a generally wet environment. In such cases, it is expected that all receptacles in the bathroom, including those near the basin, are already protected by ground fault circuit interrupter, or GFCI, protection. The toilet establishes the room as a wet location, triggering broader ground fault circuit interrupter, or GFCI, protection measures. It is important to note that the exception in 517.21 does not apply to receptacles in showers or adjacent to bathtubs. These locations require ground fault circuit interrupter, or GFCI, protection regardless of the presence of a toilet. Showers and bathtubs represent a higher risk of electrical shock due to the direct and extensive contact with water. In practical application, compliance with these rules requires careful planning and installation. Firstly, identify all patient care rooms with basins. Secondly, determine if the room also contains a toilet. Thirdly, for rooms with only a basin, ensure that all receptacles within 6 feet of the basin are ground fault circuit interrupter, or GFCI, protected. Fourthly, for rooms with both the basin and a toilet, verify that the receptacles are ground fault circuit interrupter, or GFCI, protected as per bathroom requirements. Finally, always ensure that receptacles near showers and bathtubs are ground fault circuit interrupter, or GFCI, protected. It is also essential to consider the type of ground fault circuit interrupters, or GFCIs, to be used. Receptacle type ground fault circuit interrupters, or GFCIs, are commonly used, but circuit breaker type ground fault circuit interrupters, or GFCIs, can also be employed to protect entire circuits. Regular testing of ground fault circuit interrupters, or GFCIs, is crucial to ensure they are functioning correctly. The NEC recommends monthly testing. Proper documentation of ground fault circuit interrupter, or GFCI, installation and testing is also important for compliance and safety management. Always consult the latest edition of the National Electrical Code, or NEC, and local amendments for the most accurate and up-to-date requirements. Electrical codes and standards can change, so staying informed is essential. In summary, Article 517.20 requires ground fault circuit interrupter, or GFCI, protection for receptacles near basins in patient care rooms, but 517.21 provides an exception if the room also has a toilet. Understanding the rationale behind these rules and applying them correctly is essential for ensuring electrical safety in healthcare facilities. Additionally, you must remember that local codes may amend or add to the National Electrical Code, or NEC, requirements. You need to consult with the local authority having jurisdiction, or OJ, which is typically the local electrical inspector, to ensure full compliance. They can provide clarification on any specific local requirements that may differ from the National Electrical Code, or NEC. Regular training and education for electrical staff are vital. Staff should be trained on the proper installation, testing, and maintenance of ground fault circuit interrupters, or GFCIs, and other electrical safety equipment. Training should also cover the specific requirements of Article 517 and any relevant local codes. Furthermore, comprehensive risk assessments should be conducted regularly to identify potential electrical hazards in patient care areas. These assessments should consider factors such as the type of medical equipment used, the condition of the electrical system, and the vulnerability of patients. Based on the risk assessment, appropriate safety measures can be implemented, including the installation of additional ground fault circuit interrupters, or GFCIs, or other protective devices. Consider the specific needs of different patient populations. For example, pediatric or geriatric patients may have unique vulnerabilities that require additional safety measures. It may be necessary to install tamper-resistant receptacles or provide additional ground fault circuit interrupter, or GFCI, protection in areas where these patients are treated. Ensure that all electrical equipment used in patient care areas is properly maintained and inspected regularly. Defective equipment should be repaired or replaced promptly. Regular inspections can help identify potential hazards before they cause harm. Integrate ground fault circuit interrupter, or GFCI, testing into the facility's regular maintenance schedule. Testing should be performed according to the manufacturer's instructions and documented properly. Keep detailed records of all ground fault circuit interrupter, or GFCI, installations, inspections, testing, and maintenance. These records can be valuable for demonstrating compliance with electrical codes and standards, as well as for identifying trends and potential problems. Encourage staff to report any electrical safety concerns promptly. Establish a clear process for reporting and addressing these concerns. Prompt action can prevent minor issues from escalating into major hazards. Educate patients and visitors about electrical safety. Provide information on the proper use of electrical equipment and the importance of reporting any safety concerns. Patient education can help reduce the risk of electrical accidents. Use signage to remind staff and visitors about ground fault circuit interrupter, or GFCI, protection and other electrical safety measures. Signage can be particularly helpful in areas where there is a high risk of electrical shock. Consider using wireless ground fault circuit interrupter, or GFCI, monitoring systems. These systems can provide real-time monitoring of ground fault circuit interrupter, or GFCI, status and alert staff to any problems. Wireless monitoring can improve safety and reduce the risk of electrical accidents. Stay up to date on the latest advances in electrical safety technology. New technologies are constantly being developed to improve electrical safety and reduce the risk of electrical shock. Staying informed can help you make informed decisions about which technologies to adopt. Participate in industry conferences and workshops to learn about best practices in electrical safety. These events can provide valuable insights and networking opportunities. Networking with other professionals can help you stay informed and improve your safety practices. Share your knowledge and experience with others. By sharing your knowledge and experience, you can help others improve their electrical safety practices. Collaboration can help create a safer environment for everyone. Review and update your electrical safety program regularly. Your program should be reviewed and updated at least annually to ensure that it remains effective and relevant. Regular review and updates can help you identify and address any gaps in your program. Consult with a qualified electrical engineer or safety professional to develop and implement your electrical safety program. A qualified professional can provide expert guidance and support. Expert guidance can help you create a comprehensive and effective electrical safety program.